Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, today in this video we're going to show you the #1 cause of neck pain, and
we're going to show some very recent research showing the stretches and the treatment so you can take care of it at home.
All right, Brad, this isn't part of the research, but I think you would agree the #1 cause of neck pain is poor posture.
Sure.
And what is the #1 posture that we see?
Head forward, slouched, stressing the head and neck, all kinds of problems result as
right. And so this study, and here's the title, you see it right now: Evidence-based corrective exercise intervention for forward head posture in adolescents and young adults without musculoskeletal pathology, a critically appraised topic.
Wow.
So, yeah, this is by Titcomb, Melton et al., and it was published in February of 2022, Brad.
That's amazing. You know what else is amazing? David Titcomb, that's my wife's maiden name.
Are you serious?
Yeah, she may be related to him.
Oh my God. Yeah. Okay, we're going to talk about, so they recommend 4 different exercises that you should perform for forward head posture. Yep. #1 is stretching the sternocleidomastoid muscle. #2, yeah, right there, pectoralis muscle. #3, supine chin tuck. We'll show you how to do that.
Yeah.
And #4 are W's.
W's.
All right. Let's go and start with the first one, Brad. Let's talk about a sternocleidomastoid stretch. All right. This is the best way I've seen do it. Okay. Brad was showing you the sternocleidomastoid muscles right in this area here. If you take your fingers and run them along your collarbone, right to the point where it gets to the sternum, right in the middle, now you feel up. That's the muscle right there. I'm on the right side, the right muscle. I'm going to put my fingers on the base of the muscle, and then I'm going to turn away from the muscle, and it'll really stick out then.
Yeah.
You see it?
I got a hold of mine, Bob. I'm grabbing it. They can
see it. Turn and keep pressure on the muscle, and then bend back like this. Oh, yeah, I feel it.
It sounds like you feel it, Bob. Yeah, you definitely, it's a perfect way to stretch it. You know, I'm very happy because out of the 4, we've been teaching 3 of these. So this is one that we need to add. Yep.
And it does pay
dividends?
Yes.
Yeah.
All right, let's go along the collarbone on the left side now, Brad.
Yep.
Find the muscle, turn away.
Right there.
And tip back. Oh, again.
Why, Bob? Why?
I try not to.
Why the antics?
I try not to moan. All right, next one, Brad. Now I'm gonna, we should move this out, Brad.
Oh, where are we going?
Just out of the ways.
I understand. Yeah.
Yep. And we're gonna stretch the pec muscles. Now, to stretch the lower fibers, you actually go up into a Y.
Yep.
To stretch the upper fibers, you actually go into a T.
The T.
Yep. So I'm going to go to the Y first, to stretch it all the way back. Now, I could have a pillow underneath me.
Do you want me to get one, Bob?
Would you buy it?
Oh, no, because I care. And, you know, Bob, the other thing is this recommended to be done lying down in supine, or could it be done standing against a wall?
I don't know, but I imagine you could do standing.
It's easier that way because you can relax more.
Right.
I think it may be a little more effective.
And then I'm going to do the T for the upper fibers. All right. Next one, Brad. They actually have you doing this supine, but I actually think, which means you're on your back.
Yep.
You do a chin tuck, and you lift your head up like this.
So they're actually doing some strengthening as well as...
Right. I think, Brad, I almost would prefer to do this one prone. Like, well, I have a roll towel here.
Yeah.
And
I don't have one handy,
like this,
unfortunately.
Like this.
Yep. But that's not the way they directed in the study.
No, it's not.
Yeah. So that's our
Our opinion.
Yeah. I'm not sure I agree with it, but I think it looks good. I like
the reason I agree with it is because the guy from costochondritis.
Oh,
that's
yeah.
all he has.
Yep. Well, you can't go wrong with Steve.
All right. The last one is scapular retraction, or W's.
Yep.
So basically, we're going to squeeze the shoulder blades together while keeping very good posture. Keep the neck back, retracted. Now, I think, again, if I were to add our opinion, Brad, I would try it with bands.
Oh, yes. Gives I think you can do it both ways, but the bands add the resistance. So you're doing some better strengthening, which is important. I'm going to get a little closer for this red one. And I'm going to...
It's just going to enhance what you're doing. You're going to get results quicker.
Common error, I know patients as well as I do sometimes, is the head goes forward because you're trying so hard. So you really got to...
really work on expanding and bringing everything back.
Chin tuck in, squeeze those shoulder blades together and down.
That's it, Brad.
We're done.
We gave him the 4.
All right. Well, that was pretty straightforward. Oh, wait, Bob. We should say how many repetitions because they're going to ask.
Oh, sure.
Yeah. 10 repetitions is a very typical one. A couple sets. Do them 2 or 3 times a day at least.
Yep. Take care.
Stay posturized.